Dr. Mache, and tonight we're going to be talking about 5 most common symptoms in menopause. Menopause 101, the 5 most common symptoms. And I want to welcome you here. I'm here actually in Detroit, Michigan. Tomorrow I'm going to be speaking to about 500 doctors and nurses about a lot of this very same information, and I'm excited to be able to share it with you this evening. I want to tell you that for those of you who don't know me, my interest in getting into menopause started when my wife had gone into early menopause, had surgery that threw her into menopause, and many of her doctors were uncomfortable treating her with hormones. And so I really had to figure it out so she didn't have to tough it out. Well, I want to hop in and talk to you this evening about these 5 most common symptoms, so let's jump right in. Probably the most common symptom in menopause is irregular periods. Oh, hi, I see Laura here, and welcome back. Thank you very much for the kind remarks. And so irregular periods are the most common symptom of menopause. And what happens is it's kind of like when you went through puberty. Hormones were irregular, imbalance was great, and it causes the cycles to go from very regular to very irregular. It's just hormonal imbalance. And so this goes on for a number of years, 3 to 5 years, sometimes as much as 10 years, because it's a window called perimenopause, the perimeter, the period of time around going into menopause. And let's not forget that menopause is defined by your last menstrual period. So if that's a natural menopause. So the first most common symptom is irregular periods. We can talk about that more later if you'd like. The second has to do with hot flashes. You may recall, if you've been following each week, and I'm here each Thursday at 9 o'clock Eastern, and you're welcome to bring your friends, bring people to join you, bring something you want to sip on, and just join in and try and get this information. And hot flashes is something that we did, and we had about 1,700 people in, and it was so popular. I will get back to it eventually, but if that's something that's really important to people, please let me know, and we can do another Ask Dr. Mache on Facebook Live on hot flashes. Hot flashes are the most common, and they're the most disturbing and disruptive, and as you may well know, it's caused by this release of heat. And women are always giving this kind of a sign because the heat seems to rise up and it dilates the veins and it lets a lot of heat release, and you feel that heat. And then a few minutes later, what happens is when the vessels go back down, the blood vessels constrict again, people get actually cold and sometimes chilled. And sometimes these hot flashes can occur as infrequently as a few times a day and as frequently as many times per hour. And hot flashes, as we've talked about in the past, are not just a symptom that's a nuisance, but they can be an indicator of more serious conditions, such as heart disease or other conditions. And Laura, hi. So you've had... I'm going to come back to your question in just a minute. Let me finish these 5 symptoms. The third is low libido. And actually, we talked a little bit about that last week. And low libido is kind of the 800-pound gorilla in the room. It's one of the most common symptoms, and yet only about 13% of doctors ask about it, and ultimately only about 13% of women tell their doctors they're having that problem. And the reason I talked about it last time, even though it's kind of an uncomfortable topic for women, is because only 7% of women are getting treated for low libido and difficulties with painful sex and so forth, and yet over half of women are affected by it. So it's something you really have to make sure that you realize it's okay to ask and get your symptom treated. So we talked about irregular periods, we talked about hot flashes, we talked about low libido. The fourth has to do with poor sleep. Man, sleep is a real problem for people. Hot flashes can interrupt them, sensitive bladder can interrupt them, just sleep apnea can interrupt them. So many things can do that, and as a consequence of that, people are tired, and it adds to the brain fog, and poor sleep is also a problem because poor sleep can lead to a difficulty with controlling weight. It can increase the risk of high blood pressure, diabetes, and heart disease, and a whole lot more. So that's important. And the fifth one, the 5 most common symptoms, is a weight gain. And weight gain is, believe it or not, and this may be very hard to believe, but weight gain has not been attributed to menopause per se, but it happens around the time of menopause that weight begins to change. And a lot of that has to do with metabolism, just as a function of aging. Some of it has to do with being more sedentary. Some of it has to do with the choices of foods that you eat. Sometimes there's a little bit more wine with dinner, a little bit more carbohydrates consumed, and a lot of other things factor in, like stress and the nutritional things that you eat and so forth. So there's a lot of contributors. So those are the 5 most common symptoms, and so let's talk about here. Laura is saying no period for over a year, hot flashes, irritability, and just today, let's see, what does it say? Just today, all around, and the doctors say I'm not going through it yet. Well, Laura, sometimes you know better than the people taking care of you. You know, these kinds of symptoms, I want to remind you that menopause happens at mean age of 51. But as I've talked about in the past, about 5 to 10% of women go through menopause before age 45. 1% before age 40, and the symptoms start as much as a decade before that. That's the perimenopause part. So if you're having those kinds of symptoms, talk to your doctor, get a blood test called FSH, follicle stimulating hormone. That's probably the easiest test to get. And when you start to see the values going up, that's usually an indicator that the ovary is getting less sensitive and less responsive. But there's certainly a number of tests that you can do. That's just one of them to see if you're entering into the perimenopause window. And I think it's important that you find out, because the most important reason that I feel that you need to understand your menopause and your symptoms and these common symptoms is because they can be very disruptive. They can completely discombobulate your day. They can affect your relationship, affect your quality of your work. The irritability can really get in the way with dealing with kids, partners, and workers, everything. And so what you can do is figure this out, because the treatments can eliminate these symptoms. Almost all the symptoms of menopause can be eliminated. We can't stop from getting older, and we don't want to, because that means we wouldn't be around. But we can't stop aging, getting older, but we can slow down aging, and the symptoms that I'm talking about can be reduced remarkably if you get proper treatment. Let's see. This is Doris. Welcome, Doris. I had cancer. Let's see. Having trouble. I'll tell you the truth. And here's the full disclosure. I need glasses to read close, and I went off to Detroit and left my glasses on the dresser. So let's see what I can do here. I had cancer, and I had a full hysterectomy. What can I do to calm my menopause issues and without taking the hormones? Okay. Well, of course, it depends on what kind of cancer you had, because different cancers have different concerns in terms of whether or not you can take hormones. But I hear you loud and clear, and I understand that you want to take something other than hormones. And actually, just a couple of weeks ago, I was down in Orlando speaking to a large group of women who had the genes, the BRCA or breast cancer genes, and therefore were at either they already had cancer or they were at risk of getting it, and were actually having their ovaries and tubes removed about age 35 to prevent cancer. And I gave a whole talk on managing hormone without managing menopause without hormones. As a matter of fact, I have written a book. Some of you may have seen it. It's called The Estrogen Window. And this book not only goes into great details about hormones, but also alternative to hormones. And there are many things that you can do. So to go through all of that would be a very long thing, and I think I'll do a whole Facebook Live on just managing menopause without hormones. But let me just say simply that, first of all, this is where it really gets into, you have to take care of the sum of you and not just some of you. You've got to really look at yourself holistically. And that means you've got to try to prevent some of the changes that happen. You've got to do things to control the emotions, and you've got to control your lifestyles. And so the lifestyle things in particular are very important. Lowering stress, improving sleep, what I talked about a moment ago, eating well, nutrition is highly important, and exercise, because exercise is going to get rid of some of those symptoms for you and lower the risk of breast cancer recurrence and lower the risk of heart disease, depression, and a whole lot more. But there are a whole lot of other things that you can do depending on your symptoms. And so if you have something specific, I'd be happy to address it. But in general, you have to have a real lifestyle approach. And there are a number of medications that are available. There are over-the-counter products that can be used that are, like different kinds of soy, different kinds of other herbs like black cohosh for the hot flashes and so forth. But then there's a whole host of, there's some new prescription medications like Brisdale, which is a low-dose antidepressant that can be used for hot flashes. And then there are treatments for the other symptoms as well. But a lot of it is in my book, and at another time I can go through all of that and talk about it with you. Doris is saying, goodness, this is a really, well, let's just do this because I can't help it. Endometrial cancer. Okay. So she had cancer of the uterus. Okay. Well, that's a good thing, because not having endometrial cancer, but it's the positive thing about that is that can almost always be cured. Most of the time that's cured by surgery, and I hope that you were cured. And then that opens it up to other kinds of treatments that you can take. Your healthcare providers may not want you to be taking estrogen in any event and be concerned about that, but there are a number of other options for you. So it's just a whole discussion. It's just more than I can talk about right now. But I will come back when we'll do a Facebook Live on alternatives to estrogen so I can go into it in detail for you. Angelica says, I'm 50 and still having irregular periods, and have a really foggy memory and forgetfulness, and getting more noticeable. Okay, so could this be the beginning symptom? Angela, you've hit it right on the head, because those kinds of foggy thinking, forgetfulness, and so forth is a real issue as menopause comes to fruition. it's just a matter of not getting as much oxygen and as much. The hormones have a big impact on the blood vessels dilating, which gets more oxygen to the brain, and the hormones also improve the speed in which the synapses work, where one thing goes to another in our brain, because the brain is just a huge network of nerves that fire one to the other. And yes, absolutely. And so if you get some, exercise is going to help, getting more sleep is going to help, watching your nutrition is going to help, but also hormone therapy will be very helpful for you. And if you're wondering about your symptoms and how much impact they are, I have put up right by the title up above that menopause quiz. You can go to menopausequiz.com and find out if your symptoms are affecting you, and that's a simple way to do that. So Laura is saying my FSH was, I think it says 16. Okay, so what that means is that the normal range for FSH in the reproductive years is somewhere like around 10 or 8, or it's low. And so when it goes up, it means that the ovaries are starting to not respond as well. And the reason it goes up is as follows. Your ovaries make estrogen and they make eggs. Your pituitary gland in your base of your skull here makes FSH, the follicle stimulating hormone. The FSH goes to the ovary, tells it to make estrogen, and then the estrogen tells the FSH to stop. At the same time, an egg gets produced. Well, if the egg doesn't get produced, the FSH tells the ovary to make estrogen and an egg, but the egg doesn't respond, so the FSH goes up to tell the ovary to come on, listen to me. And so what happens is, as a result of that, no FSH, the estrogen isn't being produced to turn the FSH off, and it keeps creeping higher and higher and higher. And that's what's happening. So it's an indication of perimenopause. Now, let's see. I think it's Galen. I'm sorry, I'm having difficulty because I forgot my glasses. You're having heavy periods and lots of pain, and you're 45 years old, and your tube, let's see, oh well, not looking forward to menopause. Well, at 45, there's a good chance you are getting close to menopause, of course. And if you do get a blood test for FSH, that'll give you a big clue. But the thing about it is, where is your pain and what kind of pain is it? Because menopause isn't typically associated with pain. Now, there could be a lot of clotting. If you're having big periods and you're having the cramping, kind of menstrual cramps and so forth, those are temporary, because what happens is, remember back in pregnancy, if you had a baby and you delivered, you know that the uterus is not a very big opening. The cervix, the opening of the uterus is quite small. And when clots come through, they're often bigger than that opening. So as a result, what happens? Well, you have to push the clot through, and that causes the pain and the cramping. So clotting is not uncommon. If your clots are really heavy, it'll eventually lead to low iron, because you're losing blood, and you can get anemic from that if you're having a lot of bleeding. So talk to your doctor about checking your blood count to make sure you're not anemic. Check your iron count, because that can cause you to bleed more. Bleeding heavy causes low iron. Low iron leads to more bleeding, and it's just a vicious cycle. So have that checked out, those two things. And then if the bleeding continues, you need to talk with your doctor or healthcare provider about why you're having the cramping and the bleeding. It could be just perimenopause, but you could have other conditions like fibroids, or you could be having polyps in the uterus. There's a lot of things that cause bleeding around age 45. It could just be the perimenopause, but make sure you don't miss something that is very treatable and will take care of this for you so you don't have to suffer through it. Now, let's see. Having trouble, is it Pinky? Is that what your name is? Welcome, Pinky. I don't think I've seen you before here. Welcome here. Since I'm 55 years old and I don't sleep, I do exercise and can't lose all, especially my midriff section. Well, this is a very common complaint, and you know, the sleep itself contributes to the weight gain because there's two hormones that are produced in sleep. When you're sleeping, you're not doing nothing. You're not just snoozing. You are, in fact, producing hormones. And what happens is one of those hormones, ghrelin, makes you think you're hungry, and leptin, another hormone, makes you think you're full. And so you make more of the ghrelin that tells you you're hungry and less of the leptin that tells you you're full. So that kind of buggers you up. Second thing is that estrogen keeps the weight distribution like it is, and when estrogen gets lower, it starts to shift the fat to that belly area, and you get the jelly belly and so forth. But also, it's the nutrition that you eat is very important. If you're having an extra glass or two of wine when you eat, that also contributes. And there's supplements that you can be taking. You should be sure to be taking a multivitamin. Check your vitamin D level and make sure it's good. I think that it's helpful to have the omega-3 fatty acids that are useful for this purpose. And ultimately, I'm going to be putting together a whole mini course on weight and weight control, and probably over the next 3 to 6 months I'll have that available. But if you go to my website, drmache.com, drmache.com/gifts, GIFTS, you'll find there a free download on some tips for jump-starting your weight control. And I think that will be a good thing for you to try. Check that out. drmache.com/gifts. Deborah is saying, hello here in Michigan. Yay! Yeah, I'm really enjoying it. It's a beautiful place, and it was pretty when I got here, but it just rained a little bit. I'm hoping it's going to be nice tomorrow. Well, thank you. It's great to be where you are. And Terry, welcome here. It says, do you still have your monthly mood swings, and do your breasts hurt when you used to have a period after menopause? Well, here's what's happening, Terry. You know, all of these things do continue, and people who were having those issues before menopause are the ones who are more likely to keep having them. And yes, you can still have the breast tenderness, you can still have the mood swings, particularly if you're a person who had clinical depression in the past, if you're a person who had postpartum depression in the past, after you had a baby, if you're a person who had PMS, really bad PMS, those tendencies do tend to continue. But the good news is that after a couple of years, when the hormones go down to baseline again, then they tend to level off. Now, if you decide to go on hormone therapy, that will level off your hormones so that they don't continue to be out of balance with each other, and they'll be steady state, because your brain responds very well to the steady state, but they do not like the imbalances. And so that's what's happening. And so while you may not be seeing periods even, your body is still producing hormones, but not at a level that's causing your uterine lining to build up and then to shed. So that's a problem that will go away. Now, on the other hand, if you're really having a lot of mood swings and you don't want to take hormones, then there are things that you can take to help you control the mood swings, and that's something to talk about with your doctor. Also, here's where nutrition and exercise really do come into play, and sleep. It can be a very big help for you. These all seem like what my mama told me, but you know, mama knew what she was talking about. These basic lifestyles are so critical to maintaining an optimum, vibrant health, particularly in this transition. So, yes, what you're talking about is very likely to be the case, and hormones will definitely level it out. And if you don't want to go that route, mood medications can level it out. And if you don't want to go that route, in time it's going to go away and improve your lifestyle habits, and it's going to get better for you. This is from Peggy. Welcome here, Peggy. Some of my friends have said that they were experiencing a bleeding about a year or so after a full menopause. Is that normal? It could be. Menopause is defined as 1 year after your last menstrual period, or the final menstrual period. So you don't know that till you get to a year. Now, if it's if it's just one bleed and it stops, well, that's probably nothing to worry about. If there's staining, spotting, bleeding, things aren't exactly normal and so forth, that could be something to talk with your doctor about and just to check it out. Most of the time, if that's the case, it's going to be normal, just a variation of normal. But it's important for you to know that if it continues, particularly if it continues irregularly, so you know when it's coming, it's just staining and spotting willy-nilly, then it's worth checking out. Probably it's going to end up being a variation of normal, and it's going to be fine. But if it's always irregular and always don't know when it's coming, it's definitely worth checking that out. So probably normal, but can't say for sure. Check that out. So these are, I see that Sharon joined. Welcome here. It's nice to have you. And there are a lot of things to talk about. If you wanted a ebook that I have that would give you the 5 most common symptoms, if you go to freemenopauseebook.com, freemenopauseebook.com, you can download that, and it'll give you the 5 most common symptoms and some tips that you can have there for you. And if you've got topics that you want in particular, let me know. Tell me about it, because we can put together this information for you, and I'm happy to do it. As I said, I'm very passionate about helping women have a healthy, happy, and vibrant life, and my motivation came as a result of my own personal experience helping my wife when she went into early menopause, and no one was really that happy about treating her because she did that. She went into menopause only about 7 months after a study incorrectly said that hormones cause breast cancer in particular. Let's see, Terry, why do the cysts hurt in my breast only at certain times of the month? I have not had a period in about 10 years. Well, if it's consistent, there's probably some hormonal changes that are expanding the cyst. If it is really a cyst, and it's hurting, you should go talk to your doctor about that. A, to check it out and make sure what it is, and B, if it really is a cyst, and a cyst, just to be clear, is a fluid-filled sac. And if it is a fluid-filled sac, they can actually put a needle into it and drain it in the office, and it's over, and it's gone, and that's the end of it. Because clear fluid-filled sacs are basically never cancer. It's when they're solid things that are a problem. So that's something, it could be, things stimulate the breast and hurt them, like caffeine and other foods. They can contribute to that. But if you're having pain in a cyst in your breast, talk with your doctor and make sure that it's nothing that you have to worry about. That would be my advice to you on that one. Any other questions? Be happy to answer them while we're here. We're doing these each week at 9 o'clock Eastern on Thursdays, and it's Ask Dr. Mache. I try to do Menopause 101. Occasionally I will throw in a topic that's very specific, and so if you have something you want to hear about in particular, just let me know. Hi Ellen, welcome here. What is a good natural supplement for hot flashes for diabetics? Well, I think that in general, it should be possible to use some of the same supplements that are available for other people and not diabetic. And there would be soy is a very good one. In particular, there's two kinds of supplements. There's one that I like in particular is genistein, G-E-N-I-S-T-E-I-N. Genistein is probably the most effective, and that's a really good one. And I think that with diabetes also, while not specifically for hot flashes, that fish oil is a very helpful and important one because of the anti-inflammatory components of it. And if you go to my website, again, you can go to drmache.com/gifts. I have there 10 mistakes that women make that trigger hot flashes, and you can download that, and it will help you know things to avoid. But I think that probably genistein is a really good one for this purpose. It's interesting that in the Women's Health Initiative study, the data showed that women who do go on estrogen actually have better control of their diabetes, and those with type 2 diabetes actually have a lower risk of diabetes. So that's a really important thing to know. It's not bad to be on hormones, but you have to start it in your estrogen window. And as I explained in my book, The Estrogen Window, there's a particularly important time for you to take hormones where you get the most benefit and the least risk. Terry saying thank you, and you are really very welcome. And you're from Indiana, so not too far away, down the road a piece. Well, I will stop for this evening. I want to remind you that it's very important that you take care of the some of you and not just some of you. I want to tell you that it's very important to me that we get as much information to you as we can, because what I've learned in traveling around the country talking to women's groups and even talking to doctors' groups is that people only get about 8 minutes in their doctor's visit. And as a consequence of that, there's not a lot of time to talk about the stuff that you want to. And it's very hard to get answers. And there's still a lot of confusion about best treatments. So I'm very happy to be here with you, and that's why I come each week, because I'd like to make a difference. And I hope that you will like the page, and so that you'll know, because I'm also doing some Facebook Lives at other times, because if something comes up, I want to be able to share it with you. So if you like the page, then I'll be able to, you'll pick up when I go live on other things and on other topics. And I hope you will do that. Tell your friends about it, and I look forward to seeing you next week. In the meantime, remember, better to stay well than to get well. So stay well.